Don't be so medication can also be I can say medication sometimes and I can say drugs. So we're looking at now the method of preparation of medications or drugs. I'm gonna send a poll now, just like a kind of question for us. If you see it, just answer, just reply, so I can see your response. We'll be doing that throughout the duration of this conversation, just to assess our knowledge and to see just to see what we know about the topic. So we'll be talking about method of drug preparation. There are three main methods. We have the solid preparations, as you can see, I've highlighted it on the screen. We have the liquid preparations. I've done that. I've highlighted it, and we have the semi-solid preparations. Now, under the solid preparation, we have tablets. We all know what tablet is. There's some. It's a very common mode of drug preparation that we know. We have paracetamol tablets. We have aspirin tablets. We have so many tablets. Our fluconazole antibiotics. Both of them come with tablet. So I think that's self-explanatory. Then there's something I want to add under tablet. Tablets is also subdivided into several types. Okay, it's not in the slide, but I'll just give you that as part of the discussion. So I'm gonna open my screen now so you can see what I'm doing.
San Allah, me ya haɗa ku?
So tablet,
Me ba ka so? To me na sa ta kuka?
can we please mute our call?
Please, can you mute your phone, please? That person talking with the children, please mute your listen.
Sorry, it seems sorry guys, it seems Bamidele is having a mic issue. Let him just quickly sort it out.
Oh, sorry. Can you hear me now? Yep. So I said tablets. Tablets can exist in so many forms. We have the normal tablets that we all know, the ones that we
Bacci,
swallow.
ba wasa nake ba don Allah je.
So
I'll get you.
as I said, tablets can be in the form of
Cire ni da
dispersible.
baki bani na ji yanzu ba.
We have dispersible tablets.
Na ce
That
ki
is
je.
a tablet. Can we mute our call, please, so that we can?
Ban ji da shi ba, ban ji da wannan ba.
Afsat, please, can you mute your mic, please? Afsat, mute your mic, please.
Ina magana.
So, like I said, we are talking about types of tablets. Just to make it clear, we have something we call dispersible tablet. We have dispersible tablet. These ones are the ones that when it goes into water, it's going to dissolve. So, for instance, we have some aspirin. Those aspirin, you put the tablet in water and it's going to disperse. So that's an typical example of the dispersible tablet. We also have another one that's called coated tablet. The reason why these tablets are coated is because we don't want them to dissolve in the mouth or the stomach. We want the tablets to start dissolving when it reaches the small intestine. So there's some tablets that you don't want it to start absorbing into the body in the stomach until it goes to the small intestine. That's why those tablets are usually coated. So that is another form of tablet. Then we have another one that we call chewable tablets. These are tablets that you need to chew. You chew them in the mouth because we want them to start. We want the action. We want the tablet to be dispersed in the mouth before it gets to the stomach or the small intestine. Then we have some that are called effervescent tablets. Effervescent. These kind of tablets, they're the ones that when you dissolve in water, it foams just like acid. You know, when you dissolve some acid in water, it kind of produce some foams. So these ones they are not exactly like dispersible because in dispersible it dissolves in water and it becomes clear. But effervescent, you can see the particles. It's from particles and sediments in the water. And an example of this one is the some paracetamol are effervescent in nature. Okay, so that is a very typical example of effervescent tablets. We have some that are sublingual, sublingual or buccal. So in sublingual, it's like the name implies, sublingual. Lingua is tongue, so the tablet is placed under the tongue. If somebody is having an heart attack and you want to give some fast-releasing tablets such as aspirin, blood thinners to mitigate the effects of the heart attack, you place such tablets under the tongue. Or for instance, some spray. If a patient has angina, we all know that as nurses, the first one of the first prophylaxis that you use, medication that you give for patients with angina is the GTN spray. So GTN spray is best applied under the tongue, and the reason is because it enhances fast absorption. You want the tablet to the medication to start working as soon as possible. So those ones are applied under the tongue. That's why that's sublingual. Then buccal means just in the cheeks. You leave the tablet in the cheeks and you let it dissolve gradually. Okay, so that is those are other forms of tablets, preparations of tablets. So these ones are very important to know because, for instance, council may ask questions rather, and say which tablets can be given. What is the name of the route for GTN spray? Is sublingual. So these are forms of tablet administration. So we have capsules as well. Capsule is another form of solid preparations of tablets or medication because though they are like powder in the shell. So those medications are produced in form of powder and are formed like a very little slippery capsule. That's why we call them capsule. Examples, we have amoxicillin capsule, we all know capsules, omeprazole is another form of capsule. We have powder forms of medication, just like the ORS. ORS, that is what we use for people that are having low stools, that are losing fluid and electrolytes. You use that for them to supplement. We also have lozenges. For instance, when you have sore throat and you have to use some streptils because we want the action, we want the medication to act on the throat. So we use lozenges, and then we have suppository. Suppositories are medications that we insert in the rectum or vagina. So those are examples of um, suppositories. For instance, we have suppository, glycerin suppository for people that are very constipated, or diclofenac suppository for pain. Another familiar example that we know is enemas. So enemas are given per rectum, through the rectum, so they are examples of suppository. Now we have the liquid preparations. Liquid preparations are very familiar as well. We have the solutions, that is the ones that are clear. In solutions, the drug is completely dissolved and clear. You have a clear liquid. The common example that we hear that we have under this one is insulin. We have some insulins that are clear, crystal clear. Your normal saline are clear. Normal saline is a medication, just so we know. It's a form of medication as well. So, and they look very clear, crystal clear. So they are solutions because they are clear. Whereas suspensions is another form of liquid preparation, but these ones have particles, just like our familiar antibiotics, the amoxicillin. The amoxicillins, they have particles, so they are not crystal clear like solutions. You have emulsion. Those of us that work in the operative department, example of emulsions are propofol.
dawo
They
ba
are
kuɗa da na
they
ganin
look
komai
like
ɗin.
mixture of two liquids that do not dissolve. These ones are not too familiar. The elixir, the syrups for children, and them tinctures. Those ones are not too familiar. And then we have the semi-solid preparation form of drugs or medication. So those are ointments. These ones are not solid, they are not liquid, they are in between, semi-solid. So we have ointments, we have creams. All our creams, some creams are forms of medication. We have some gel, like diclofenac gel and other ones for pain. Diclofenac is for pain. And we have some paste. So I've given these ones, and I've given some examples in front. So when we have this material, please let's go through to have more idea about it. And now the next topic is dilution of solutions from stock. There's a formula that we use when we dilute medication for dilution. It's pretty basic, it's nothing difficult. The formula is here is C1 V1 equals C2 V2. C1 is the initial concentration. There are some medication, for instance, normal saline. Normal saline is 0.9% sodium chloride. That means there is a concentration of 0.9% in 100 ml of the solution. That is the meaning of 0.9% normal saline. So when you see 10% dextrose, that means in 100 ml of the solution, there is 10%
Sugar.
concentration of sugar.
Owó tún mi yọ ẹ́. Ohun tún mi bẹ̀ mí.
So that is what it means. So now this is an example, a very small example I've given us. A stock solution of potassium permanganate. That is stock solution means that is what is provided from factory. That is what is produced or manufactured by the factory. That is stock solution. So you know that automatically that is the initial concentration of the medication. So a stock solution of this medication needs to be diluted to 2% in a final volume of 100 ml. So the initial concentration is this 10 from the factory. What we are looking for is 2%, which should be the final concentration. And this is here, final volume of 100 ml. That is self-explanatory. So using this formula, just let me give you like a very easy example. You have you want you this is you have 100 naira in two places, two notes of 100 naira, that is 200 naira total. And this is 10 naira. How many notes of 10 naira will make you 200 naira? That is exactly what it means in simple terms. So to make you to have 200 naira, you need 20 notes, 20 pieces of 10 naira. That is a very simple way to look at it. Using the formula, C1 here is 10%. The volume one is what we are looking for. C2 here is the 2%, and V2 here is 100%. At the end of the day, you have your initial volume to be 20 minutes. It's pretty easy, but if you have any issues, any concerns, just let us know after the class. We are very happy to help you. And we have so many calculations as well ready on the app. If you log in, subscribe, log in the app, there are some very simple basic calculations that will help you as well. Steps for dilution All of us are nurses. We are pretty vast in this. We give medications most of the time. We know how to dilute our medication. The first thing you do is to identify the required volume and concentration. You need to know what you want to give. You need to know how many milligram or how many mils of medication you will be administering. Okay. If you are administering paracetamol, if you are giving paracetamol tablet or liquid or whatever form, you want to give 1 gram. Okay. 1 gram, if it comes in 500 milligram, that means automatically 1 gram is 2 tablets. So you need to know what you are giving, the concentration and the volume. Then you measure the stock. If you are giving paracetamol 1 gram, now solution, you are giving a suspension rather to a baby. And you look at it, it comes in 250 milligram in 5 mils. So you know you are giving 20 mils to the baby or to the person to make 1 gram. So you need to identify the required concentration first and the volume. Then you measure the stock solution. You know how much is in the vial or in the bag, or how much comes from the manufacturer's package. Then you add the correct diluent. That means you have to, um, if either sterile water or normal saline, you mix it thoroughly. If you need to mix it because if the medication is not mixed properly, you might be given a very different dose of medication. For instance, if you are given 5 mils of medication and it is not properly mixed, there is a possibility you are given a very different concentration because the medication is not evenly mixed. It is not mixed thoroughly. That is why you need to mix them properly before you give medications. And then you label. You label them because it is very important to avoid medication errors. The time of mixing the medication is very important. The concentration or like the dose of the medication is also very important. So those are the steps. They're pretty self-explanatory and simple for nurses. We have the next topic here is common dilution ratios. So medications come in 1 in 10. For instance, epinephrine that is used for anaphylaxis, it comes in 1 in 10. Even though we don't need to do this because it comes already diluted from the factory. I think in the olden days we need to do that. For instance, we have Uzol. When we use Uzol solution or some hydrogen peroxide for cleaning, we need to dilute them or some what's it called? There's one Savlon. Yeah, when we use Savlon, it's usually diluted on the word. So, but now I think everything is pretty standard from factory. If I may be wrong, but I think things are getting better now. So there are some that are done in 1 in 100 dilution. That means if you have 1 mils of the solution or of the medication, 1 mil of the medication, you get 100 mils, you get 99 mils of water. So if you are doing 1 in 10, for instance, of a medication of epinephrine, for instance, so 1 mil of epinephrine will be diluted with 9 mils of water. That is what it means. It can be water, it can be normal saline, it can be sterile water. So anything that is recommended dilute is going to be used. In 1 in 100 dilution, that means 1 mil of the medication is added to 99 mils of the solvent of the dilution. It can be water, it can be normal saline. And this last one, 1 in 1,000, this is pretty rare, but it is very used for those of us in the ICU or those of us that will be perioperative nurses or those of us that will be in the emergency. You're going to be using this a lot for patients with cardiac conditions. So it is diluted from factory because it is not convenient to have 1 mils of a medication and 999 mils of diluent. So this is pretty done from factory. Like I said, the common example is adrenaline. Moving on, we have rules of drug administration. As nurses, we need to know the right of drug administration. It is very simple. It's a very common acronym. You need the right patient. You should not give a drug belonging to Mr. A to Mr. B. That is a drug error. So you need to make sure that you are giving the drug to the right patient. You need to be given the right drug. If the doctor has prescribed um, penicillin, please don't give amoxicillin. It is not. It has to be the right drug, and you need to check the prescription and medication label. The reason why we need to check this is sometimes it's not the nurse's fault. The fault could be from the pharmacy. Okay, the patient's name should be on the medication. The pharmacy may have made the mistake of sending you amoxicillin instead of penicillin. They might have sent flucloxacillin instead of doxycycline. So you need to check to make sure that it is the right drug. If a nurse give a wrong medication, even if the fault is from the pharmacy, but the liability lies on the nurse that gave the wrong medication. So as nurses, we need to make sure we give the right medication. Then the right dose, very important. It can be overlooked as well. It may not be the nurse's fault. The initial fault could be from the pharmacy, like I said, or from the doctor. The doctor might have prescribed 1.5 gram of paracetamol, but you know as a nurse, for a patient weighing 50 kg, 1.5 gram is probably an overdose. So we are studying pharmacology not because we want to prescribe initially, but because we want to help our patient to have the right dose, the right medication. So we can ask the pharmacist or the doctor, I think this medication, this dosage is wrong. Okay, this dosage is wrong. That is why we should have all of this knowledge. So the right route. Some medications can be given through various routes. It can be given sublingual, it can be given intravenous, it can be given intramuscular. You need to make sure you're giving the route as prescribed by the doctor. It is very important. Give the medication as prescribed by the doctor. So we are giving it to the right route. The next one is that we have here is right time. Some medications needs to be given at a very specific time. So if the medication is a 4-hourly medication or a 12-hourly medication or a daily medication, you need to follow the timing. It is very, 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 very important. Very important. Right time. Can you see my screen, everybody?
Oh no, we can't see your screen again, please.
Okay. I think I don't know what happened here. Sorry. It's working now. So right time. So you need to make sure that this right time is very important. There are some medications that are time sensitive. I'll give you some examples. For instance, lansoprazole. Lansoprazole, like omeprazole, lansoprazole, are given before food. Some needed to be given before food. So if you're giving the medications after the patient has eaten, you're not helping the patient because the timing is wrong. Some medications need to be given early morning. If a patient has hypothyroidism and you're administering levothyroxine, for instance, okay, it needs to be done very early in the morning before the patient eats anything. So that is why timing, particularly, is very important. Some nurses may think, oh, as long as the patient has a tablet, it's fine. No, it doesn't work like that in all cases. So that is why it is added to the route to the 5 rights of drug administration, and this makes you a very good nurse. We have some additional rights for patients. Patients should that patients should know. Right documentation. When you do your medication, please document because if it is not documented, it is not given. It is not given. That is a proof that you have given your medication, not just medication, everything pertaining to your job. That is the proof that you have rendered care to your patient. And please do not document when you have not rendered care. Don't be nurses that said, I have done this for the patient and written it down without doing them, please. We have a right response. When you give medication, that is not the end of your job. You need to make sure that the medication is actually working. If a patient complains of pain and you give a pain relief to to the patient, you should also make sure that the patient's pain is resolved. If the medication is for instance, if it is an infection, that's a common one that we have, eye discharge, and the doctor prescribed chlorpheniramine eye drops. We need to make sure that that medication is actually working. The eye discharge is actually clearing up. The wound, the infection is actually healing. Okay. When you're not getting the right response, you can let the doctor know. You can escalate the patient's care, and those are the things that will make you good nurses. The next one is right to refuse. A patient has a right to refuse the tablet or medication or your care as a whole. So patients have the right to refuse as long as the patient is autonomous. That is, the patient is able to make decisions. A 5-year-old baby or a 2-year-old baby does not have the autonomy we are talking about. Okay, you need to. Babies generally do not like medications, so this is applicable to patients that can decide, make decisions, and they're autonomous. Please, as we're going, if you have any questions, just let me know. We have some calculations. They are pretty simple, straightforward here. When we are done with the class, I will send my material to you so that you can go through. And if you have questions, please let us know. We can deal with that. I'll just do one or two and then we leave. We have the basic formula method, like it's a basic one. You have the desired dose, available dose, the volume, and then the amount you give. For instance, the doctor prescribed 500 milligram of a drug. That is the doctor prescription. But what you have on the ward is a 250 milligram per tablet. So how many tablets do you give to make up 500 milligram? That is two tablets. So it's quite straightforward. It's quite easy. But then in the exams, if you have a calculation in the exams, it's quite easy to be overwhelmed and be confused. That is where we make mistake. But if you take your time to read the question, write down the variables given, write down the values given in the question. So you can just take your time and then give it a very good answer. The next one you have here is ratio and proportion method. So this one, a prescription requires 20 milligram of a drug. If you look at it, it's quite similar to the one above. So the prescription is 20 milligram, and then the solution you have is 10 milligram per mil. So how many mils will you
I
give to
can't
make
see
up
the
20
screen.
mil? Can you all see my screen? I think somebody cannot see my screen.
You need to,
I
need
can't
to
see the screen, no. I can't
just
see it.
just click on the screen that is displaying, not the voice talking. There are two Bamidele here. One is displaying the screen and one is talking. So if you check, if you see the first Bamidele is the one talking, then the second account is displaying the screen. So if you just click on the screen, then the screen will come, it will enlarge on your own screen. If you click on the whiteboard displaying the screen, test that and let us see.
Moving on, I will not take our time on these calculations because I'll be sending the materials to you, and the app as well is there. It has it has vast amount of resources that will help you for calculations. And like I've said, please just let us know if you are struggling with any part of this lecture, any part of the topic, let us know. So I will just go ahead and just scan through all of these questions, all of these calculations rather. This is a body weight method. This one is giving medications per body weight. So the prescription is not going to be a blank prescription. It will be based on the weight of the patient. This is mostly used in the pediatrics area, and in some other complex units like the um, perioperative unit, bones and plastic units, ICU, because the weight of the patient is used to calculate the dosage given to patient. And it's easy as well. For instance, if the child is weighing 20 kilogram and the dosage, the prescription is 2 milligram per kg, so it is 2 milligram for 1 kg, and the child weighs 20 kg, so that is 20 times 2. So it's quite easy. And I'm sure if something like this comes in the exam, you just want us to calm down. There's no need to rush. Sorry. No rushing, just calm down, because sometimes all of these numbers and symbols can be very, 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 very overwhelming, and we make mistakes. But I'm assuring you it is easy. Just let us know if you need help. Refer to the app for more resources. Body surface area method. This one is based on the body surface area of the patient. This is mostly dealing with people that have skin issues, and also people undertaking some chemotherapy. So, as a bones and plastic nurses, you might be using this body surface area to administer some or most of the medication, or people in the oncology department, because in the chemotherapy unit, it's also used to prescribe some of their medication. I hope it is clear. If you need help, please let me know. This is pretty simple. We've done this before last week. Some abbreviations. Pahora is okay. These are rules of administration. We have some routes, simple ones, done it before. The oral route is when you swallow. The sublingual, like I said, is placed under the tongue. The buccal one is in your this buccal one is in your cheek. We have the parenteral route. This one is now further divided into 4. Parenteral means is injected into your body. It's taking it injected into your body, and it can be intramuscular, subcutaneous, intravenous, intradermal. Those are the examples. Those are the common examples of parenteral route. There's another one that is the intrathecal. For people that have undergone surgery, if you have gone to theater posting, for instance, you can give the anesthesia through the intrathecal route. So that is another example. We have the topical route, inhalational route, and the rectum. We've talked about that, the suppositories, enemas, for as an example. This is here because I want you to know that some medications can be given in 2 or more routes. So, for instance, we have the common one, paracetamol. It can be oral. It can be taken as oral tablet. It can be taken as intramuscular. It can be given intravenously. Okay, so those are the routes. So one medication can have 2 or more routes of administration. That is why it is very important that you should check the medication, check the prescription to know the route that is being prescribed. We've done this common abbreviation last week. Just a reminder for us if you need them. Right, this here is very, very, very important, and this is what makes you a very brilliant nurse. These are some common drug overdoses and their antidotes. These are the common ones that is within the scope of the Nursing and Midwifery Council of Nigeria. Okay, this acetaminophen here is just another word for paracetamol. Please, just when you see this, it means paracetamol. Okay, when you have an overdose of paracetamol, the common symptom you have is liver toxicity. That is the symptom, and the antidote is N-acetylcysteine. These ones, I'm telling you, please, you need to focus. You need to know them by heart. It is very, very important. It's a lifesaver. It's not going to only help you pass your exams. You need it in your practice as nurses. Opioids here, examples of opioids and morphine are the pentazocine that we use at home in our wards, not at home. Sorry. So The common effect is respiratory depression because opioids generally depresses your respiratory system, and the antidote is naloxone. Benzodiazepines here, examples are the diazepam, the lorazepam that we have. Um, the common symptoms is CNS depression. The person is sluggish, the person is drowsy, the person have a very slow reaction time, and the antidote is flumazenil. Okay, heparin here, overdose of heparin is bleeding. You bleed. Heparin and warfarin, the common symptom is bleeding. Both of them, the patient bleeds. And the antidotes are different, even though they have the same symptom. So this is another place where the MCQ questions, the OBJ questions can be very tricky. For instance, if you are asked, a patient, as a nurse in the emergency department, a colleague has given an overdose of warfarin to a patient, what is the antidote? Okay, so even though warfarin and heparin has the same symptoms, which is bleeding, but they have a specific antidote. For warfarin, it is vitamin K injections, and for heparin, potassium sulfate. Let me give another instance. For instance, if you are working in the emergency and a boy is rushed into the hospital, a boy has taken a whole bottle of paracetamol from where the mom kept it. So the question may be in the form of what is your first medication? What is the first line of action as a nurse? Okay. The first line of action is make sure this antidote N-acetylcysteine is on your crash cart. Crash cart or crash trolley is a trolley that you have in emergencies. So make sure this antidote is there. Okay. For instance, question may come in the form of if you work in a what's it called? If you work in a rehab unit is where we take care of people that are drug addicts. So and you notice that one of your patients has overdosed on drugs. Okay, you should be thinking of naloxone, which is the antidote. So this is what you need. This aspect here is very important. Please take note of it. We have more of this on the app, and I'll give you this material as well after the class is over. So all of this, why are we talking about drugs? Why are we talking about medications? Because they are. Why are we talking about the right of drug administration? Because there are legal issues, because of the legal implications. Now we'll be talking about that. The storage. Medication should be stored according to manufacturer's guideline. Very, very important. We have temperature control here. Some vast, like for instance, your insulin, that's a very common example. Insulin should be kept where? In the fridge. So unopened insulin should be kept in the fridge. If there's an insulin that is not kept, that is not opened, unused insulin, and is kept just on the trolley, room temperature, you should destroy that medication because if you give it, it is not going to have the effect you expect. Okay, the potency of the medication is gone. Some medications should not be exposed to light. For instance, those of us that work in theater, some for like propofol should not be kept in direct sunlight, or diazepam should not be kept in direct sunlight. In fact, most medication should not be kept in direct sunlight. Okay. Now we have controlled substances. All of us on the board that have gone to board, we have CD cupboard. That is where we keep all controlled drugs. Controlled drugs such as morphine, pentazocine, midazolam, propofol, all of those medications are controlled substances and should be locked. Should be locked. Expired medication should be destroyed because people can make mistake. If you keep expired medications, people can make mistake and administer them. Like I said, certain drugs like vaccines and insulin require refrigeration. This is like patient rights. You need to take consent. Make it a habit to get consent of before you give medication to patients. Let them know that you want to give them. Let them be happy to take your medication. Prescribing authority. only authorized healthcare professional. The reason why I said only authorized healthcare professional is because gone are the days when only doctors can prescribe. Now, some nurses are able to prescribe in some settings, in some countries. We are not going to limit ourselves to a sport. So some people are so knowledgeable and they've gotten some certification that authorize them to prescribe some medication. So only authorized professionals can prescribe. You should know the five rights of medication. You need to know them. Very important. Because if you make an error, you cannot transfer the blame. Even if the pharmacy is wrong, but you still give the medication. Even if the doctor is wrong, you still give the medication. So you are responsible. We've said this before, documentation. You need to document properly what you've done, what you gave. Adverse effects reporting. If there is an error, if you made a mistake, please report it. The reason for reporting is not to blame you, it is to help the patient. For instance, if you're giving overdose of a medication so that the antidote can be given and the patient can be monitored, and also to be able to train other healthcare workers, other nurses to stop them from making the same mistake. For record keeping, you need to have a marshal. This is what we sign, medication record. We call it marshal. I'm not sure if that is what we call in different settings. It could be different from each hospital settings, but the general name is marshal, medication administration record. We have a controlled substance log. That is our CD book. For CD book, CD book should be there for all CD medications. So when you want to take a controlled drugs, you need to be there. Two people need to sign it and make sure that it is given. Inventory management. This is taking a stock of a medication. If you have 10 tablets or 10 vials of a medication, you need to make sure it is 10. Just keeping record. And this is patient record. Some patients have allergies. They have previous history that you need to know. For instance, some contraindications. If a woman is pregnant, you cannot give some medication because it will affect the pregnancy. Very important. So the patient record will tell you if this is a pregnant woman to be sure you are giving the right medication, that the medication is safe for the woman. Okay. There's a medication that causes Reyes syndrome in pregnant women. Can anybody tell me what that medication is? If given to women, to pregnant women, it will causes Reyes syndrome. That's an assignment for us. Reyes syndrome is spelled as Reye. Reye. So it's called Reyes syndrome. So let's read about it, everybody. And as soon as you're able to know what it is, just drop it in the group. Oh, this thing is not typing. This there's an S there. Can you all see my screen, please? I think I'm having issues typing this.
Yeah, I can see your screen.
Okay. Don't know why this is not working. So that's Rare syndrome. That's the spelling. Please let us. That's an assignment for us. Let's moving on, please. So when you do not follow the rules, this legal consequence of non-compliance, when you do not do what you're supposed to do as a nurse, you do not look at the five rights of medication, you are exposing yourself to legal issues. You can be sued as a person, you can be dismissed from your job, you are putting your patient at risk, okay, and you are making the profession look bad. So that is very important that we as nurses we do the right thing. Drug abuse. Some of these medications can be abused. Stimulants easily abused. cocaine, amphetamines, because it gives them energy, it gives them the euphoria, the feeling of euphoria. So we should know about them. Some depressants also can be abused. Sertraline, diazepam, all of those phenobarbital can be abused by patients. Opioids can be abused. Hallucinogens can be abused. Cannabis, all of these can be abused. They can be prescribed legally, but we should know that they can be abused. So when patients come in and they're asking for more of this medication, they say they're in pain, they are in pain. You need to assess the pain level to make sure they actually are in pain before giving more opioids for pain relief. Safety measures we've talked about this already. The five rights are very important. You store the medications properly, right temperature, right light exposure. The expiry date should be looked at. Implement double checking for high risk medication. That is why two people need to sign when giving a controlled drug. Okay. Maintain sterility of injectable drugs, keep controlled drugs in secured cupboards, and dispose of expired medication. Nurses' responsibility in drug administration. This is the last one. Sorry. So now we've looked at everything. What is our responsibility in drug administration? It is to verify prescription before administration. So we need to know what is this doctor giving to this patient because they make mistakes too. And we are here to verify what they are prescribing. We need to educate patients on their medication. Why is my patient may ask you, nurse, why am I taking omeprazole? Why am I taking levothyroxine? Why am I having this morphine injection? Why are you giving me these antibiotics? We need to know why they are on the medication and the effects of the medication. So if this medication is going to cause some side effects, we let them know. Oh, this medication is going to is going to make you drowsy. This diazepam will make you drowsy, make you feel tired. It is expected. So the patient will have peace of mind. You monitor for adverse effects. Okay, not just giving medications, making sure that they are having the desired effect. You document accurately. You follow your hospital policy. You must follow hospital policy because that is what will help you in case there's any issue. If you follow the hospital policy and there's an advert reaction, as long as you are following the hospital policy, you'll be covered. Okay, it will not be put down as as an error on your part. Ensure proper communication with healthcare providers. Please communicate properly. If you want to say 10 milligram, please say 10 milligram. Some people say 10, give 10 of insulin. Is it 10 mils? Is it 10 units? You need to be clear on what to say as regards medication administration. And then you need to report any errors promptly. This is not to blame you, but it is to help the patient get help as soon as possible. Um, in conclusion, drug preparation is what we do mostly as nurses. It is our hobby. It is a very simple thing. You will do this from the first day of being a nurse. Even as student nurses, you do medication. It is not something to be afraid of. It is easy. Don't be scared of doing medication. But what you need to do is just follow the guidelines as as stated in your in the workplace policy. And that's the end of this lecture for today. Please, if you have any questions, let me know before we call it a day. Please, if you have questions. If there are no questions, I have I've given you two questions. The first one is I want you to read about Rare syndrome, and when you do that, just drop it in the group. And the second assignment I want to give you is let me share my screen so you can see what I'm typing. Rare syndrome, and second thing, we talked about some heparin and warfarin. We need to talk about iron now. INR. INR. The full meaning is let me type the full meaning. So it is international normalized ratio. Read about it. I'm giving you this because we mentioned warfarin and heparin. So that's the two assignments I'm giving you. Just read about it, put them in the group when you're done. And if you have any questions, please let me or my colleague know. Thank you very much for your time tonight. It's a pleasure being here today.
All right, thank you very much, Mr. Bamidele. Please, is still welcoming question before we close for the day. Still welcoming question. If you have any question, quickly in few minutes, just let's quickly ask.
If there are no questions, I don't want to take our time. Lastly,